Hello, I'm Amber Bennett, Associate Professor of Clinical Occupational Therapy and Director of Admissions, and I'll be sharing some information about our holistic application review process. Holistic admissions practices had been implemented in our entry-level master's program a couple of years prior to the start of the entry-level OTD program. The Association of American Medical Colleges defines holistic review as mission-aligned admissions or selection processes that take into consideration applicants' experiences, attributes, and academic metrics, as well as the value an applicant would contribute to learning, practice, and teaching. Holistic review allows admissions committees to consider the whole applicant rather than disproportionately focusing on any one factor. So in a nutshell, with holistic review, each applicant's file is reviewed in its entirety, and no single factor excludes an applicant from admission. In advance of opening the application for our new entry-level OTD program, we convened a faculty work group to reevaluate our admissions criteria. We started our review here with the division's mission, vision, and core values, since review criteria should be in alignment with these aims. We also looked at how our program defines excellence in the context of our mission and goals. The outcomes for our entry OTD program graduates are here, and the unifying theme for our curriculum is in the background: justice, equity, diversity, and inclusion. With our division's values in mind, we used the Association of American Medical Colleges EAM model to identify the experiences, attributes, and metrics that we wanted to capture in the application. Here are some of the EAM items we were interested in capturing for our program. Using this, we revised the personal statement, short answer questions, and video prompt on our application. After revising the components of the application, we considered how bias might impact the review process, which led to some of our main challenges. Holistic review outlines some best practices for reducing bias in the application review process. One is to use a diverse committee representative of the program's core values and varied in their experiences, practice areas, and demographics. It was a challenge to ensure we had diverse representation while also considering faculty loads and being careful not to burden our BIPOC faculty with too many requests to assist with various initiatives and committees. Securing our committee has been a task that has required significant effort each year. Another best practice for reducing bias is creating rubrics to capture the desired applicant qualities from the mapping process. It was a challenge to conceptualize these rubrics to capture things like life experiences and identity. Thankfully, we were able to consult with our university's instructional designers while developing the rubrics, which was very helpful. And our admissions committee completes calibration training every year to ensure reviewers are consistent in their ratings using the rubrics. Lastly, we had to consider how much weight to assign to different components of the application to determine an overall holistic score. Literature shows that overweighting cognitive criteria like GPA and GRE score reduces admission of minoritized applicants and compromises the holistic review process. We encountered a challenge here as well, since there was no central guidance in the literature or from our university regarding how exactly to consider or weigh these items. Ultimately, we limited weighting of GPA to 33% of the total holistic score, with the other components weighed equally to each other. We have admitted 3 entry-level classes since implementing holistic admissions, 2 entry masters and 1 entry OTD class, and they have been among the most racially diverse cohorts in our program's history. Our first entry OTD admitted class was 43% white, 36% Latinx, 33% Asian, 10% Black, and 1% Native American. We continue to evaluate our admissions processes every year and recognize the importance of our role in growing a more representative workforce. As gatekeepers to the profession, academic programs have a responsibility to increase diversity in the healthcare workforce and positively impact health equity in our society. Thank you.